Today we are going to discuss in the sixth video on how to interpret blood test report. So today the heading is lipid profile. Our body has storehouse of energy in the shape of fat cells, and all these fat cells, they are filled with lipids. Lipids mean diverse groups like fats, oils, hormones. And lipid profile, in this we will check the components of this test, that is cholesterol, HDL, LDL, VLDL, triglycerides. If the levels are high, there is a risk of cardiovascular disease, that is heart attack and stroke, due to plaque buildup and reduced supply of oxygen to all body organs. Further, there can be chronic inflammation, there can be pancreatitis, metabolic syndrome, and now we will discuss each heading in detail. Now, considering each point of lipid profile, first comes cholesterol. It means the total amount of cholesterol in your blood, including both good and bad cholesterol. The range is less than 200 mg per deciliter, and if the levels are too high, they may indicate an increased risk of heart disease. Second comes HDL, high density lipoprotein. It is often referred to as good cholesterol, and HDL helps remove excessive cholesterol from the blood. Normal range in men, it is considered 40 mg per deciliter, and in women 50 mg per deciliter. Higher levels are associated with lower risk of heart disease. It is the matter of good cholesterol. Then third comes LDL, low density lipoprotein cholesterol. It is called bad cholesterol because it can lead to plaque buildup in the arteries. The normal range should be less than 100 mg per deciliter, and if it is more than 100 but less than 129, it is near optimal. Borderline means more than 130 to 159 mg per deciliter. If the level is too high, that is more than 160 to 190 mg per deciliter, it is considered high. The high levels increase the risk of atherosclerosis and cardiovascular disease, stroke. Considering triglycerides, a type of fat in the blood that provides energy, high levels are often associated with obesity, diabetes, and excessive alcohol consumption. The normal range, it should remain less than 150 mg per deciliter, and if it is more than 150 but less than 200, it is borderline, and if it is above 200, it is high, and if it is more than 500, it is very high. And elevated levels of triglycerides, they increase the risk of heart disease and pancreatitis. VLDL, very low density lipoprotein cholesterol. It is a type of cholesterol that carries triglycerides in the blood. Normal range is from 2 to 30 mg per deciliter, and the elevated levels of VLDL levels are there associated with higher risk of cardiovascular disease. Sixth is non-HDL cholesterol. It means total cholesterol minus HDL cholesterol. It includes LDL and other harmful lipoproteins. Normal range is less than 130 mg per deciliter, and the significance is the comprehensive assessment of bad cholesterol in the blood and the resultant bad effects. Cholesterol, LDL, and triglycerides, they play an essential role in the body, but they can become harmful when their levels are elevated and they result in negative impact to health. The negative effects, that means atherosclerosis, that is excessive cholesterol can build up on the walls of the arteries, forming plaques that narrow or block the blood flow. Second, in heart disease, plaque buildup in coronary arteries can reduce oxygen supply to the heart, increasing the risk of angina, heart attacks, and coronary artery disease. Now comes stroke. Brain. Plaque in the carotid or brain arteries can block blood flow to cause a clot leading to a stroke. Now we discuss the prevention and management of these higher levels of lipid profile, that is cholesterol, LDL, triglycerides, VLDL. We should take a healthy diet. We should focus on fruits, vegetables, whole grains, lean proteins, and healthy fats. Second is regular exercise. Physical activity helps reduce LDL and triglycerides while increasing HDL, that is our good cholesterol. Certain medications like statins, fibrates, or omega 3 fatty acids may be prescribed to manage the levels. One should avoid smoking and alcohol. These contribute to lipid abnormalities and cardiovascular risk, so better to stop these things. Few words on excess of triglycerides and fat storage in our body. High triglyceride levels often result from excessive calorie intake, leading to their storage in the fat cells, that is, adipocytes. As fat cells enlarge, a condition called hypertrophy, they become dysfunctional. They release inflammatory molecules called adipokines, that is, tumor necrosis factor, alpha TNF alpha factor, interleukin 6, IL 6, and monocyte chemoattractant proteins 1, MCP1. These molecules activate immune cells and promote chronic low-grade inflammation in the tissues, especially in the fat tissues. One thing more, triglycerides are carried in the blood by lipoproteins like VLDL, and elevated levels of VLDL levels can trigger immune cells, particularly macrophages, to engulf these particles. This leads to foam cell formation, that is, macrophages overloaded with lipids turn into foam cells, a hallmark of atherosclerosis, and they cause cytokine release. Foam cells secrete pro-inflammatory cytokines, amplifying the inflammatory response. They cause oxidative stress as well, and they cause endothelial dysfunction.